Our bones are not just stiff structures that help our bodies maintain balance and movement. They are also a dynamic system, constantly regenerating and renewing themselves. However, like any other part of our body, bones can be affected by various conditions, causing them to weaken, break easily, and affect our ability to move. Here's an interesting look at common bone health disorders, along with actual statistics to help you better understand these conditions. 1. Osteoporosis, the silent enemy of bones. Osteoporosis is a common condition in older adults, particularly in postmenopausal women. It is characterized by weak bones that become brittle and easily broken. This condition results from an imbalance between bone formation and bone resorption. It can lead to symptoms like back pain, height loss, and most notably, easy bone fractures. The loss of bone density happens silently over many years, often only discovered when a fracture occurs. An interesting fact is that about 1/3 of women over 50 and 1/5 of men will experience an osteoporosis-related fracture during their lifetime. Studies show that bone density decreases by approximately 0.5% to 1% each year after the age of 30, with the rate of loss increasing significantly after menopause in women. Meanwhile, men typically start experiencing bone density issues after the age of 70, with a lower but still significant frequency. To protect bones from osteoporosis, maintaining a diet rich in calcium and vitamin D, combined with weight-bearing exercises, is crucial. Calcium is found in foods like milk, cheese, and leafy green vegetables. Vitamin D, which helps the body absorb calcium efficiently, can be obtained from sunlight and foods like salmon, eggs, and milk. 2. Osteoarthritis. When joints no longer move smoothly, osteoarthritis is one of the most common joint-related conditions, especially among older adults. While osteoporosis affects bones, osteoarthritis directly impacts the cartilage in the joints. Cartilage, which acts as a cushion for smooth joint movement, gradually wears away over time, causing bones to rub against each other, leading to pain. According to a study, 1/4 of adults worldwide are affected by osteoarthritis, particularly the knee joint, the most commonly affected joint, and the hip joint. People with osteoarthritis often experience joint stiffness in the morning and pain when moving or engaging in physical activity. In the U.S., approximately 27 million people have osteoarthritis, and this number is expected to increase as the population ages. To alleviate pain and protect joints, aside from using pain relief medications, gentle exercises like swimming or cycling can help maintain joint flexibility and reduce the risk of further degeneration. 3. Fractures. The concern for all ages. Fractures are a common problem that can happen to anyone, regardless of age, and they may result from trauma, overuse, or simply the effects of osteoporosis. Each year, around 6 million people in the U.S. experience bone fractures, making it one of the leading causes of injuries. Fractures can occur in any part of the body, from the arms and legs to ribs and pelvis. The process of bone healing involves several stages. First, inflammation, then the formation of a soft callus, creating cartilage tissue to join the broken ends of bones, and finally the development of a hard callus that restores the bone's strength. Large bones like the femur can take 8 to 12 weeks to fully heal. Most fractures are not life-threatening, but if not treated in time, they can lead to long-term complications. 4. Paget's disease of bone. When bone remodeling goes overboard. Paget's disease of bone is a disorder that affects the normal bone remodeling process, causing the body to create new bone tissue uncontrollably. As a result, bones become weak and deformed, increasing the risk of fractures and causing chronic pain. This disease affects about 1 to 3% of older adults, particularly those over 50 years old. Research shows that Paget's disease can double the risk of bone fractures, including vertebral fractures. Large bones like the pelvis and spine can be severely affected, causing symptoms like back pain, joint deformities, and restricted mobility. 5. Rickets and osteomalacia. The result of vitamin D deficiency. Rickets is a condition where bones become weak, soft, and prone to fractures, commonly seen in children due to vitamin D deficiency. This condition can lead to improper bone development, making children more susceptible to fractures. In developing countries where malnutrition is prevalent, about 1 in 4 children are at risk of rickets. On the other hand, osteomalacia, which is more common in adults, results from the lack of vitamin D, leading to calcium deficiencies in bones and increasing the risk of osteoporosis. Studies show that vitamin D and calcium supplementation can reduce the risk of osteoporosis by up to 30%. 6. Bone cancer, a rare but serious risk. Although bone cancer is not as common as other types of cancer, osteosarcoma and Ewing's sarcoma are serious forms of bone cancer that can develop in bones. Bone cancer can spread to other parts of the body and is a leading cause of death in 30% of bone cancer patients. Bone cancer is typically treated with surgery, radiation therapy, or chemotherapy, depending on the stage of the disease and the location of the tumor. However, studies show that bone cancer can be effectively treated if diagnosed early. 7. Prevention and treatment measures. Nutrition and exercise. Ensuring adequate intake of calcium and vitamin D is crucial to protect bones. Weight-bearing exercises like running and walking help increase bone density and reduce the risk of osteoporosis. Regular health checks. Bone health checks using methods like DEXA scans can help detect early signs of bone density issues. Osteoporosis and Paget's disease treatment. Medications like bisphosphonates and teriparatide can help reduce bone loss and increase bone density. Bones are the solid foundation that enables our bodies to move and maintain stability. While bones can experience problems due to aging and external factors, with a healthy diet, proper exercise, and regular checkups, we can protect our bones and maintain a high quality of life for years to come.